Good evening and welcome to the May 2025 edition of Glaucoma Australia's live Q&A webinar series, which is proudly brought to you by our long-standing and generous supporters, Glaucos. My name is Val Toswell and I'm one of the 3 orthoptist patient educators here at Glaucoma Australia, as well as your host for this evening. Before I introduce tonight's guest speakers, I'd like to acknowledge the traditional custodians of the lands, skies and seas in which we collectively gather for tonight's event. I pay my respects to our elders, past and present, along with their emerging leaders. Tonight's topic is using the SightScore polygenic test to assess glaucoma risk in family members. Genetic screening for glaucoma is a topic that's often mentioned during our patient calls, so we're absolutely thrilled to have 2 leaders in this field with us this evening, ophthalmologist Professor Jamie Craig and genetic counsellor Ms. Georgina Maxwell. Jamie is a Matthew Flinders Distinguished Professor at Flinders University in Adelaide and a Senior Consultant at Flinders Medical Centre. He was named South Australian Scientist of the Year in 2024 and is an NH and MRC Level 3 Investigator Grant holder. His research focuses on the molecular genetics of blinding eye conditions, including glaucoma, congenital cataract, and diabetic retinopathy. Jamie established and leads 2 national ophthalmic disease registries, the Australian and New Zealand Registry of Advanced Glaucoma, or ANZRAG, and RADAR, which is for diabetic retinopathy. And both of these registries have contributed to the discovery of disease-causing and disease-associated genes. They've also influenced clinical practices and improved patient outcomes. Professor Craig has published over 440 peer-reviewed articles, very busy, and co-founded Sionix Bio, a company commercializing a polygenic risk profiling saliva test for glaucoma. Georgina is a genetic counsellor with experience working in clinical and research genetics, and we were fortunate to have Georgina presenting in our webinar series last month. Georgina is the genetic counsellor for Sionix Bio, supporting the expansion and integration of SightScore into care for family members of individuals with glaucoma. She's currently undertaking her PhD with Professor Craig and Dr. Emmanuel Suzeau at Flinders University with the ANZRAG. Her PhD focuses on furthering our understanding of the genetics of congenital and childhood glaucoma, family communication around genetic testing, and the experiences of families accessing health services. Georgina is passionate about improving our understanding of how our genetics plays a role in our health and promoting equitable access to services. During this live Q&A event, Professor Craig will discuss how the SightScore test can be used to assess risk in unaffected family members and how it can help people at risk of developing glaucoma take a proactive role in their healthcare. Thank you, Jamie.
Thank you very much for the kind introduction, Val, and thanks to you, Georgina, as well for joining us. We're going to walk you through, I guess, a little bit of background about the way in which the SightScore genetics test has come to be a real clinical test available to Australians and now New Zealanders and Americans. And that has been derived in large part from the research that we've done over decades to identify some of the genes or many of the genes that cause glaucoma and the risk of glaucoma getting worse. Many of you may be aware that this test is performed from saliva, but it is a DNA test, so it could equally be performed from blood, but we decided to go for saliva to make it fairly universally available and to be able to be ordered through optometry as well as through medical practitioners. So the process is quite quick. It's probably about a 30-second process to get the sample, and the doctor or optometrist would fill out some information about your type of glaucoma or the suspect status of the glaucoma, and that goes off to the Sionics company digitally. DNA is extracted from the saliva, and an array test is run that develops a risk profile for you, and we'll go into some of that during the presentation. So if you could give me the next slide, please, Georgina. Yeah, just to disclose that this is a commercial company now that is actually doing the work. So that is Sionics Bio, who is based here in Adelaide, and that is actually providing the service. And this has been licensed technology from Flinders University and the Queensland Institute of Medical Research, where my colleague Stuart McGregor works. And Georgina is a genetic counsellor who is involved at the level of family member testing, which has only just been released, and we've made that available so that people within families of glaucoma cases who do not yet have glaucoma could access testing direct from Sionics, because without an optometrist or ophthalmologist in the picture, that previously was not a pathway that existed, and many of our patients are asking how their family members could have a test, and this is what we've done to set that up. So next slide, please. Just recapping a little bit on what I think everyone on this webinar would very much know, and that is, what is glaucoma? There's several different types of glaucoma, and our test is predominantly aimed at open-angle glaucoma or primary open-angle glaucoma. We've got some really great recent data that shows that the test also works well in pseudoexfoliative glaucoma and pigment dispersion syndrome. But, as yet, we have not released our testing for angle closure glaucoma, which is coming along really nicely. But this talk will really be predominantly about primary open-angle glaucoma, and in particular, its applicability to adult glaucoma. So what Georgina spoke about a month ago was our work in childhood glaucoma, which is a devastating and rare disease, but the SightScore test is predominantly designed to work in adult glaucoma. So I think all of you know that if glaucoma is picked up at an early stage and treated, that progression can be slowed and prevented, and people do well. But there are patients who present very late in the disease process, and this is very unfortunate, because if vision is already lost, it can be impossible to bring that vision back. The risk factors, the one we're really going to talk heavily about, is the family history and genetics. We know that if a close family relative is affected, that an individual has a 9 times increased risk of developing glaucoma. There's some other risk factors like African heritage, and advancing age is also a major risk factor. Most patients have high eye pressure, about 70%, but 30% can develop glaucoma without a high eye pressure. And there is a continuum between those. The SightScore test works well for both types, but perhaps slightly better for high pressure glaucoma. Next slide, thanks. In terms of the way that the genetics works, we know that glaucoma is one of the most hereditary diseases in the whole of medicine, and particularly for a common disease, these types of tests work better for glaucoma than anything else, like heart disease, Alzheimer's disease, breast cancer. So glaucoma is the perfect disease to do this kind of common variant testing. About 3 to 5% of patients can have a very strong gene in a family called a rare variant, such as myocilin, and those families are often flagged because there are just so many family members that are affected. But the majority of families, there's just an aggregation of lots of small genetic variants, what we call common variants, which we are now in the most recent version up to millions of genetic variants that we've discovered that contribute to the risk of developing glaucoma. And that's what the SightScore test does. It amalgamates all those genetic variants and puts you on a continuum from 0 to 100 as a number of your relative risk in the population. So in this example, someone would be right in the middle. That is, they're not more likely to get glaucoma and they're not less likely. But a lot of our patients who have glaucoma actually have high risk scores. So if you advance to the next slide, Georgina, this would be an example of somebody who has a very high genetic risk. And we see this not infrequently in our patients, because we see a lot of patients with severe disease. this sort of thing can be very, very useful if you're finding people very early who are glaucoma suspects, but they return a very high risk score, because that means that they're more likely to get worse. They're more likely to need treatment to be started, to have extra treatment needed, and they're more likely to have other family members who will be affected by glaucoma. So that's the point of this talk, is that those people who are younger in the family or who haven't got glaucoma yet could access testing, and that will give us an idea of who is more likely to get glaucoma down the track. One thing that I'm very interested in is the surgery aspect. So we're finding that people who have very high risk scores are more likely to need an operation for glaucoma. That's very effective, but it's a bit more risky than using drops or laser. And we're doing a trial of looking at early laser for people with high risk scores who have not yet got glaucoma for prevention, but that's a fairly new area, and it's not yet in standard practice. So next slide, please. So if we look at the types of situations where we're seeing a lot of good usage for the SightScore test, when I see patients who are glaucoma suspects, sometimes the question that's asked by the optometrist is, does this person need to start treatment yet? Are they going to get glaucoma? Could they be monitored by the optometrist, or should a specialist see them? And how often should they be seen? So all of those sort of questions can be influenced by the SightScore result. Particularly when it comes back very high, we're more likely to move towards treatment or treatment escalation. If it comes back medium to low, that patient may be very appropriate for ongoing monitoring and optometry, and less often than what they may have otherwise been seen. So for some people, it can lead to less visits and less expensive testing. But in other patients, it means that they will more rapidly move towards a specialist and surgery. In glaucoma cases who already have glaucoma, for me, sometimes the question that's asked is, this patient's slowly progressing, I think they need surgery? And I can often get a bit of guidance on that according to how high their genetic risk profile is. And, sometimes there may be examples where people have been on a lot of treatment and perhaps more treatment than they needed to be on. And with a lower score, we may be able to actually reduce their treatment. Today, we're going to be talking about the applicability to family members who as yet do not have glaucoma, because a lot of patients ask me, well, what do I do about my children or my siblings? And Georgina will be talking about that. So next slide, please. I think actually, are we up to the point where you were going to take over, Georgina?
I think you were going to talk about just this family case example, if you like, Jamie.
Yeah, no, very happy to do that. I mean, this is a really interesting family that I look after, and the patient at the top of the slide, Susan, has had glaucoma since she was about 40, and her pressures have been very high and difficult to control, but she's had lots of treatment, multiple surgical procedures, and a lot of medical therapy, and she's done quite well. Now she's 90, and she hasn't actually lost really much of her visual field at all, but she has had a very difficult time of it, and her 4 or 5 kids have been very worried about getting glaucoma. And as we've seen those children as part of our research program, we've done the SightScore tests, and one of them is very high. That's Susan there, and Deb, these names are not their actual names, but her kids have got high scores, and it's quite common in families where there's multiple family members that you see high scores that are throughout a family, but there's other times where one sibling may have a low score and someone else has a high score. In this case, both of these children have gone into our laser prevention trial. So it means that these kids I think are likely, to have an easier run through the disease process than the mother. So in this sort of example, it's common for us to see a family where there's sort of bad glaucoma and more than one person has a very high score. And in these cases, I think it's very valuable for the children and siblings of the affected person to have a SightScore test to give some guidance on how severe things might be, and who should see that patient and how often. So next one. And I'll keep going, Georgina. Yeah.
Yeah, just this one.
Yeah, we will really gratefully acknowledge the support of Glaucoma Australia, who, before we had these sophisticated tests like the SightScore, we already knew how important it was for family members to be made aware. And Glaucoma Australia has always been extremely strong at that education piece in glaucoma. So we formalised a program where everyone who's part of our ANZRAG registry and progressor study would be able to receive this sort of education profile where they could list other people in the family's names, and we would then send out information via Glaucoma Australia, which gave very clear instructions about the type of glaucoma that the index case had, and that would be taken by the family member to an optometrist who would then do an examination. And we've reached, thousands of relatives through this approach. I think 3,800 at the last sort of count. Thank you to Glaucoma Australia's support of that program. And as we receive feedback back, at least half of those people who have gone and had an exam have had some signs of glaucoma or been diagnosed with glaucoma. So it just shows how prevalent the family history and the genetics is in this disease. But I should point out that there's patients who do not have a known family history who get glaucoma, at least probably 45% of the cases we see. And so sometimes they're the ones who have the least awareness and are more likely to present with advanced stage disease. So the good thing about the SightScore is it cuts through all of that, and the test result stands whether the person knows of their family history or not. I saw someone today who's adopted, who's got a very high score, who otherwise would have had no way of knowing that they were at a very high risk. So I guess we're very privileged to move from the period where this was a shotgun approach where one size fits all and all family members got the same advice, to now a more personalized approach where the score will determine how often someone should be seen and perhaps who should see them. So at that, I'll hand over to Georgina to give a bit more insight about the actual SightScore for family members. So thank you.
Thank you, Jamie. And yeah, as Jamie has said, the SightScore test has been available for a little while now, ordered through clinicians, so ordered through optometrists and ophthalmologists. However, this is a new program that we're starting where family members will be able to contact the service directly to be able to order the test to understand their risk for future glaucoma. This service is at this stage certainly only being offered for people who don't yet have any signs of glaucoma or early signs of glaucoma, so aren't yet considered glaucoma suspects. So certainly family members who are curious and want to take a proactive role in their health and their glaucoma management. So as Jamie has talked about, there are many benefits to having SightScore and a PRS for glaucoma, specifically for primary open-angle glaucoma, including helping your clinician to determine how often you need to be seen, at what age you might benefit from starting screening. If you're at a high score, should we start bringing you in a little bit earlier than we would otherwise, and can also help your clinician determine when to start treatment and what sort of treatments might be beneficial for you based on your score. There are a couple of caveats in this test, in that a genetic test can only predict your likelihood of developing glaucoma compared to others of a similar ancestry. So it cannot diagnose glaucoma. In that case, it doesn't replace going to see your optometrist from that recommended age, and doesn't replace having other sorts of eye tests as well. It also, a high score doesn't guarantee that you definitely will develop glaucoma, just as a low score doesn't guarantee that you won't develop glaucoma. So it's an indication, a relative risk, rather than being able to give you a definite answer. Again, as Jamie said, there are a small number of families who may have a rare variant that isn't picked up through this type of polygenic risk score testing. I guess those sorts of families we'd be flagging when there's quite a lot of family members who have developed glaucoma, or glaucoma at young ages, so sort of under 40. And as I said, this service where we're offering testing without needing to go through a clinician at this stage will certainly only be open to people who don't yet have signs of glaucoma. In order to order this testing, you would go to our website, which is the Sionix Bio website, and we have a tab about our tests where you can read more information to help you determine if this is the right test for you, learn more about the test itself, ask any questions that you might have. Testing is overseen by healthcare professionals, so myself, Jamie, a genetic pathologist as well involved. So while it doesn't require a clinician to order that test, we are involved in just making sure that we're giving you the best advice possible. In terms of what testing would look like for families that are seeking testing directly, you would order your test online. We ask you some questions about your family history. That sort of helps us flag if there are lots of family members or a young age at diagnosis where we might need to have a chat with you about whether this is the most appropriate type of testing and how this testing might help with your care. Once that testing is ordered, we mail you a kit in the post where you can provide a saliva sample. So nice and easy. I know a blood test put a lot of people off, so the saliva sample is quite an easy way, and you can drop it back in your regular Australia post box. Notably, this test is only available in Australia at the moment as part of this program. Then you will receive your results by email, and part of receiving your results is that you get a patient-friendly version of the results that we aim to be easily understandable. You'll also get a letter from myself and Jamie having reviewed the information you've provided us in your results. You also have the opportunity to chat with me as a genetic counsellor to talk through your results, and certainly we know that regardless of what score you get, it can bring up some pretty complex emotions sometimes if you weren't expecting that result, or families and health history can bring up some topics that we can chat through as well, if that's something that you're after. In terms of possible results, I've got a couple of example results up on the screen for you. So the first one would be a low risk result. So we can see for a patient who had a polygenic risk score of the 5th percentile. Again, that's not a 5% risk you're going to develop glaucoma. That's saying that if we grabbed 100 people of similar ancestry to you, you would be on the sort of, you would be 5 out of 100 in terms of risk of developing glaucoma. So that's something that we like to make sure that you understand when ordering this testing and your risks. And so your results tell you a little bit more about your risk compared to the average person, and about when screening and what sort of screening and who should might be beneficial to be screened by. Just as we might have a high risk score, which indicates that your risk is quite a lot higher, again, not 95%. We can see here that the 95th percentile is actually more closely related to about a 20% risk of developing glaucoma over your lifetime, but certainly that's a lot higher than the average person. So you might benefit from, we can see going in for screening a little bit earlier. So if the national recommendation is 50, maybe we go in a bit earlier. Guidelines certainly recommend for certain ancestries, or if you have a strong family history of glaucoma, talking to your ophthalmologist or your optometrist about going through starting to get testing earlier. And then certainly if you start to develop signs of glaucoma, your clinician might decide to see you more regularly. But yeah, certainly we provide you with some personalized results. So we really aim for these to be digestible and usable for you. You get that patient-friendly report, so it's not quite as dense as a clinician report. However, you can request the clinician report as well. Certainly if you have a high-risk score, or we see something where we think that you might benefit from having screening earlier, we can provide referrals as well to your local optometrist, or we can send those results on to an optometrist or an ophthalmologist that's involved in your care, so that they can use those scores to help guide their decisions about screening and management. You also get a results letter that explains your results in a bit more detail. Genetic counselling is included, so you can have a chat with me about your results and any questions you might have, because this is a new type of testing, and quite reasonably people have lots of questions about these sorts of things. And again, we can refer you on to specialists where relevant. And just finally, we've got a whole lot of thank yous. There's a lot of people that have been involved in the research over many, many years that Jamie can certainly attest to. And we're very grateful for their support, as well as all of our participants in Glaucoma Australia, who have really helped us immensely in doing all of this research and getting to where we are now.
Thank you, Jamie and Georgina. I absolutely love the combination of ophthalmologist and genetic counselling because the support is so holistic in that area. We know that if you have a direct family relative with glaucoma, you're significantly more at risk of developing it yourself. And SightScore is just an amazing added avenue for those who are related, may not have been tested, and therefore they're not aware of their own glaucoma state. So thank you so much for expanding on all of that. I know that, as I mentioned, this topic does come up a lot in patient calls, and thank you for that really clear explanation of how it works and all the background research so far. We have had a number of questions come through from our audience. The first question is from Tom. What are the intervals for assessment of family members who have not been diagnosed with glaucoma if they are over 50 years of age?
Thank you very much, Val and Tom. It's a great question. For me personally, I see these patients for a good baseline assessment, and if the findings are completely normal, they have no signs of glaucoma at all, I recommend 2 yearly that they have a thorough assessment. There's often a misconception that if you've been checked and everything's okay, well, you're cleared and you don't have to come back. And obviously that just isn't right, because the rate of glaucoma goes up dramatically as people get older. But, we found through the Target study about half of the people who went for these checks had some signs of a glaucoma suspect status or already diagnosed glaucoma that they didn't know about. So the clinician who sees the person in those cases will probably recommend more frequent monitoring. So if there's some suspicion with a pressure or optic nerve appearances or the OCT scan, they may say that that person's coming back in 1 year or 6 months. But if they're completely normal, I do thorough assessment every 2 years. This is where the SightScore can really help, because, if the score comes back very high, those patients may come more often. And if it comes back low, they may actually be able, to just maintain that 2 yearly check with an optometrist ongoing and not, be seen more frequently than that. Thanks.
Yeah, thank you. It can really influence the appointment schedule, can't it?
For sure.
Next question from Liz. I have been diagnosed with low tension glaucoma. My optic nerves have had a few hemorrhages. Would this test still provide diagnostic information for my children?
Yeah, that's another really good question. We see a lot of patients like this with normal tension glaucoma and disc hemorrhages. And we find that genetics is still definitely important in this subgroup of patients. And I have been surprised. I had a patient not so long ago who was sort of about 40 who had this exact presentation, who did not know that there was any family history of glaucoma, and her score came back at like 99th percentile, and we were quite surprised by that because it was quite unilateral as well. One eye was much worse affected than the other. So I think the answer is definitely it can provide diagnostic information. I will say that high pressure glaucoma has slightly better correlation to the SightScore test. So, people where there is high pressure in the family, it may be even more predictive, but it has a very definite role in normal tension glaucoma as well. I would say that cardiovascular risk factors like blood pressure and uncontrolled cholesterol and heart disease can also be important factors, and sleep apnea in normal tension glaucoma. But there are a lot of patients that do not have those risk factors who have, normal tension glaucoma too. So my answer would be yes, it still has importance.
Great, thank you. A question from Fred. To what extent can the PRS test predict the severity or rapidity of progression of optic nerve damage in cases of mild IOP with minor field test glaucomatous evidence to minimize treatment intensity?
Yep. I really love this question. because it really gets at the heart of a lot of the research that we've done in the Progressor study, which is taking people with early stage disease who are suspects or very mild glaucoma with mild field loss, and then looking what happens to them over time. And we're into, probably 2,300 patients enrolled, some of whom have had like 8 to 10 years follow-up now. And we have very, very strong evidence now about the role of the SightScore PRS test in predicting what happens to those patients. And the answer is that the higher the PRS test, the more likely the patient starts treatment if they're a suspect, and the more likely that the treatment escalates if they're already on treatment. So high scores are correlated to increasing treatment, the number of drops and laser, and there's a very strong correlation with those that go on to need surgery. So I think the answer to the question is, if you're a suspect and the score is low, you're much, much less likely to need treatment and treatment escalation. If you've already got established mild disease, you're probably, I think, more likely to be able to be managed with one treatment, that is one eye drop. So if you've been escalated through treatment for good reasons, that may still need to be the case. But sometimes people are escalated through treatment because they did one bad field test, or, there's sort of reasons that perhaps we would not have necessarily said that is a good and strong reason to escalate treatment. So yes, I think it has a role in some patients being able to be reduced on treatment, or even if they have no evidence of glaucoma damage, to have a trial off of drops and monitored, for example. But that would all be at the discretion of the treating clinician, who's got access to the information in front of them, who can look at the OCT, the field. They know what the pressures were on the day, the corneal thickness, all these other factors. But the high PRS levels do predict structural progression on OCT and increasing treatment and surgery. And we've written one paper about visual field progression too. So it has a very strong role in early glaucoma.
Brilliant. Thanks, Jamie. Another question. So a question from Con. Do other people find the drops of VISO-PF difficult to administer? I have carpal tunnel syndrome and it's very difficult to squeeze the bottle. And that's a comment that we often hear during our phone calls as well, about the VISO-PF bottles and drops.
Yeah, definitely not alone, Con, because I've had exactly the same complaint from patients. The problem is, it's a particularly good fixed combination of drops because it has no preservative. And when we've lost other preservative-free preparations over the last 6 months, like Saflotan, there's not always a lot of options. So, there is Lumigam preservative-free, which is in the little individual sachet thing that would be easier to dispense, but you can get a lot of redness from that drop. So I actually really like the Viso PF dorsolatum, but the tube is stiff, and it has that particular nozzle that doesn't allow air back into the tube. So it's a requirement of it being preservative free that makes it, I think, difficult to dispense. We haven't found a way around it. There may be a holder that you can get in the UK that we could potentially get out here. Glaucoma Australia is looking at that actually helps with the squeezing. And there might sometimes be a role for letting those bottles warm up a little bit just prior to dispensing, because the plastics often are even stiffer when they're cold. So that's something to think about. But if you just literally can't use it, you either have to find a different preservative-free prep, or try one of the similar drops that's not preservative-free. That's like Costor, Cosopt, or Azaga, all of which I think have easier bottles, but they do have preservative.
Preservative.
So bring it up with your own doctor and Glaucoma Australia. Yeah.
Great, thank you. I think you touched on this one during your presentation. Does SightScore test for all types of glaucoma?
Yep. I mean, the answer is it's most strongly developed for primary open-angle glaucoma. We've already said it that is effective in normal tension glaucoma. We've got very, very good evidence that it has a role now in situ exfoliation glaucoma in a recent publication, and pigment dispersion syndrome, although those are, special cases where you have to take different things into account. The things that we would caution against use is that we've only started to look at angle closure and mixed mechanism narrow angle glaucoma recently. So I think it will have some role, but we'll have a separate PRS test for angle closure probably within a year to 18 months. And the caution, as I think Georgina very carefully pointed out, is that in very young onset glaucoma, there's more likely to be rare variants involved. So like very, very good coverage of average glaucoma cases in Australia, but special riders for some things that are not yet covered, but we're working towards. Yeah.
Great. It's a work in progress. Marty wants to know, from what age do you recommend you get tested?
Yeah, that depends a little bit on the situation in the family. I think like our general guidelines are, it's good for people to have a first checkup around the age of 40, or certainly by 50. That's the age at which a lot of people are needing reading glasses, and they often turn up for the first time to an optometrist. But we would say it is a good plan for everyone to have a baseline check for glaucoma by 50. And if there is a family history, maybe by 40. Now, if there's people in the family that got the disease at, say, 38 or 40, we should be going a little bit younger than that. So in families with severe disease and things, definitely earlier checking is a good idea. But, from general population, it becomes increasingly common after age 50.
Yeah, and I guess the SightScore is available from age 18, so it's up to the individual and the family at what point a person would want to engage with that sort of testing. It can be beneficial to have that a little bit earlier before you start screening, because it can help guide screening. But at any point, it may be beneficial for you. Yeah,
I think like for someone to have a SightScore test at, say, 30. If they find out that they've got a very high score, that's actually valuable for that person to have that knowledge, because they're going to get into care well in advance of any visual loss. You don't necessarily want to go, I think I'll worry about this when I turn 50. I think if you're going to do this type of predictive testing, it's good to do it in sort of, younger adulthood. Yeah.
We've got a couple more minutes left and 2 more questions. So from Jay Morgan, the last slide said sample received was in 2023, but it wasn't reported until 2025. Is that how long you have to wait to get results?
No, sorry, this is my fault. I used an example report. We generally say about 4 weeks from the time the sample arrives at our lab in Melbourne. Again, all of the testing and the data is kept here in Australia. So about 4 weeks. So if you're going through the family service, we would say about 6 weeks for the time to be shipped from your door to the lab and then get results back. So not 2 years.
And I think that's actually a really important question, because in the past, some genetic tests did take a very long time. And certainly when we were doing the research grade testing for mycilin in the ANZRAG, which was done for free, through our research programs and funding, that it wasn't uncommon for it to be a year to 2 years turnaround. But with this as a commercial test, we have a really strong obligation that we want those results to be turned around in 4 weeks. I mean, it's often good to allow an extra week or 2 just for your clinician to receive it. Or as Georgina said, if the family member test is being done from home, there's an additional sort of postage step there. But yeah, we're very, very confident. All the patients that I've done and ordered, and we've well over 1,000 tests now have been very well met in terms of that 4-week turnaround.
Terrific. Our final question is from Jill. My family history is strong in glaucoma and blindness. I have it, and so my children and I took part in providing a saliva test to a study in Queensland years ago. Are the results available for SightScore?
Yeah, so I this one, I mean, I can speak certainly for the ANZRAG study that I run and the Progressor study. Our participants do sign consent forms that mean that they will get feedback if we find interesting results. Now, that applies to the rare variants. For the polygenic risk, because it has to be accredited to provide feedback to patients, to receive like a accredited polygenic risk result, it has to pass through the NADA accredited pipeline, which is what the Psionics company has basically, developed over the last 3 to 4 years. And, that has significant costs attached to it, like genetic pathologist, meeting all the accreditation standards, insurance, Georgina, all these things. So, those tests will receive reports that your clinician will get, or through this family member service through that will be available to the person who's ordered the test. However, the Queensland study that you refer to, I think, was more performing it in an anonymous fashion, where it contributed to the development of new data, but not with a result that could be fed back to patients. So I'm indirectly involved in that, and I think I could say that will not result in a SightScore test coming back to you. So that would have to be done through either your clinician, your optometrist or ophthalmologist, or for family members via Georgina's service.
Sorry, and just one more question from David Mackey. As an ophthalmologist in Tasmania, we often have to take a fairly paternalistic approach, unfortunately, for many eye problems. Can I order the SightScore as a batch and then distribute to patients?
Yeah, so we have a few different methods of ordering testing as a clinician. So if you get in touch with Psionics, our team can talk to you about it in more detail. But yeah, we can send you out a bunch of tests that you can do, and there's different ways of organising that payment, whether you do it through your clinic or whether you pass that on to the patient, whether we post kits straight out to the patient, or again, whether you want to just keep them in your clinic, noting that they do have an expiry. It's about a year in most of our kits. Just because of the chemicals that are essentially preserving the DNA. We want those to make sure that they're still working. But yeah, if you get in touch with us at Psionics Bio, then we can organise setting you up as a service and shipping some kits out to you to get you set up.
Great. Thanks, Georgina. So I just want to say thank you again to Jamie and Georgina for your time this evening. Fascinating presentation. And thank you to everyone who has joined in to watch this evening. If you have any questions that weren't answered, please direct them to glaucoma@glaucoma.org.au or phone us on 1800 500 880, and we'll forward to Jamie and Georgina for their responses. So thank you again for your time. For those who have friends or relatives who couldn't join the live tonight, it will be available on Glaucoma Australia's YouTube channel, and that's easily accessed at the bottom of our GA website homepage. So thank you to everyone, and enjoy the rest of your evening.
Thanks very much.
Thank you.